about to visit one of the top public hospitals in India. Pushed into a crowd of desperate patients, I was astonished by the lack of infrastructure. People and children were waiting on the floor, waiting for attention, and it was a stark contrast to what I had seen in Canada. I had spent some time volunteering at a local hospital in Georgetown, and although the Canadian system had its flaws, the resource shortage I was seeing in India was much more evident and dire. After seeing this reality, I was sad, surprised, but also motivated. I was motivated to do something, but the problem was I wasn't sure how. In high school, when we were passionate about a problem, we were just pointed to fundraising or petitions. But that wasn't enough. I wanted to do something that would make a tangible impact. So I set out just to do that. After plenty of trials and errors, I've come to a place where I believe I have achieved what I set out to first do, to make a meaningful impact. We're always told and encouraged to take action, but never told how exactly. So how exactly did I do it? When I started 2 years ago, I was lucky enough to be in a program called the Knowledge Society, which is a global community of ambitious youth who are really passionate about solving some of the world's biggest problems. My mentors there helped me develop a framework for the problem I was passionate about, which was maternal mortality. So I want to share my experience and the steps I took so that maybe someone in this virtual room can be the next person to change the world. Looking back at our journey, I believe there were 5 steps that we did. Steps 1 to 3 helped us understand the solution and the problem that we wanted to impact. Steps 4 and 5 were crucial because they helped us design our actual solution and look at it in different perspectives. However, through all of this, one thing remained crucial: to talk to people. Even if you don't know where to start, you'll realize that there are some things that you can only understand and learn from communicating, not just research. Let's take a look at our journey. As you may have imagined, finding solutions to a problem that affects the world was not an easy undertaking. There were 3 main barriers we faced. First, cultural implication. Our goal was to tackle maternal mortality. We were an average group of students, high school students from Toronto, looking to make a difference. Our team didn't know the environments as well as the locals did. This meant that we had a huge gap of our understanding of the culture and the community in Nigeria. In hindsight, because of the lack of cultural experience and knowledge about the community, we started off with making the assumption that all Nigerians had access to hospitals and pharmacies. So we started to form a solution around that, only to learn from meetings that the distance between hospitals and pharmacies in Jigawa is a large barrier for drug access. For example, a Google Maps estimate shows that the nearest pharmacy and the 3rd largest settlement in Jigawa was a 6-hour walk away. Cars and other transport options are not easily accessible, so for most people, their mode of transport was walking. A second instance was when we thought the drug misoprostol, which can prevent and manage postpartum hemorrhaging, was affordable for most people. For the majority of Jigawan residents, 85 to 95% of them live in rural areas, so it wasn't affordable for them, and even a $5 investment would be an issue. We were stuck. How would we reduce the market price of a drug? We decided to have a few emails and meetings, and soon we were able to land on a call with a key pharmaceutical company in Nigeria. Our team was able to thankfully negotiate misoprostol at 50 cents for 4 tablets, which is just 10% of the market rate for the drug. Now began the flood of virtual meetings. There was a significant language barrier, the time zones were all different, and sometimes there was issues with technologies and Wi-Fi, and we had to be up sometimes at 5 a.m. for calls as well. I'm actually a fast speaker, but I learned I had to talk slowly, especially on Zoom calls when there might be Wi-Fi or internet issues, specifically in Nigeria as well. Zoom calls themselves took a long time because 1, it was really hard to set up the platform there sometimes in Nigeria, as well as, like I mentioned before, the inconsistent internet and Wi-Fi connection. It was a lot of, can you hear me? I can't hear you, you're muted, which I'm sure we've all come across a lot of times during this pandemic. The second barrier was lack of knowledge, experience, and expertise. We had very little knowledge about the problem at hand, specifically the medical side of it. Learned that meetings were the only way to solve this issue. We talked to pharmaceutical companies, nonprofit organizers, government representatives, and tried to understand their perspective and what they knew about it. We had multiple meetings to better understand the cultural and social implications of our problem and our potential solution, and if our solution made sense to experts and people who have been in this area and who have been in this field and been able to make impact and done research in the field. First was a bit intimidating. These people were all experts who had worked with organizations, universities all around the world, and we sometimes felt like we had to prove ourselves, I think, to show that we were passionate and serious about solving this issue. We were in high school and wanted to tackle such a big issue. We realized that admitting that we didn't know something was okay, and in the end it would just increase our credibility even more because we were willing to learn. Beginning, I remember avoiding calls. I wanted to keep everything on email. I didn't know how to talk on calls, especially to experts. But I soon realized that the best way to communicate and learn is through meetings, and they were very, very helpful. My first meeting with an expert, I was so nervous. I came prepared with a long paragraph of all these questions I wanted to ask the expert I was talking to. But I soon realized after that I wasn't really listening to what they were saying. I just wanted to get through my questions. So the next meeting, I came with fewer questions prepared, and instead I was actively listening to what the expert and who I was speaking to was saying, and that way I was able to ask follow-up questions and learn much, much more. We were also lucky enough to meet an incredibly kind and helpful nonprofit on ground there called the Family and Youth Health Initiative, and they were able to help us acquire more contacts and eventually also get in contact with the Ministry of Health in Jigawa. Finally, the last barrier was age. My team consisted of high school students, so we had to face barriers like credibility and expectations as well. We had to overcome what people thought of us and help them understand that we wanted to implement our solution. It was hard because we started off with zero connections in Nigeria and knowing no one there. We looked through nonprofits working in the same field in different organizations. We went through LinkedIn and looked through, again, just searching up people in that field or in Nigeria. Sending an email effectively was something that I learned was very, very important. My first emails were paragraphs long. No one would want to read them. After a lot of trial and error, we sent hundreds of emails, hundreds of follow-ups, and finally got a few responses. And that was all we needed. My co-founder likes to call it chicken feed theory, which is basically your contacts introducing you to their contacts, and it just branches off like that, and you that way get warm introductions to more people and more contacts. Although there were all these barriers, we were able to overcome them because of the framework that I had mentioned previously, which I'm going to share, as well as, of course, our mentors and everyone else that was able to help us and speak to us during that time. Inspired by my experience in India to create meaningful change in healthcare. Maternal mortality drew me for a couple of reasons. Firstly, around 830 women die every day. That's the equivalent of 4 large airplanes full of people crashing due to maternal mortality. The severity of this problem was shocking to me. If this was a problem that was affecting so many people globally, why hadn't I heard about it before? Secondly, after some research, I realized that the problem was preventable. Most of the births in Nigeria are done by traditional birth attendants, which act as midwives, taking care of the delivery of the baby, after birth, any complications. But we learned that 60% of these traditional birth attendants, TBAs, were not formally educated or trained to assess any complications or manage any complications during and after delivery. The leading cause of maternal mortality, postpartum hemorrhaging, can be reduced by 85 to 90% by a drug called misoprostol that costs less than $1. Hence, this was my gateway into the world of making a change in the field, choosing a problem that interests me. If we have a specific problem, we needed to find the root cause. My team was super excited and motivated, but we had no idea what to do. At first, we started off with separate research. My internet browser history was full of Google searches on what is maternal mortality, where is it most prevailing, why does it happen? But at times it just ended up with me finding unfamiliar terms or confusing research papers. I felt like the content was too advanced for my understanding sometimes. So I decided to start small and go on YouTube videos or small pages and understand the basics first. After a lot of research and confusion, my team came together and settled on what we thought the root cause was. We put it into three main buckets, and the bucket that we chose was postpartum hemorrhaging, which is bleeding. But our three buckets were the three main causes of maternal mortality. The way we came to this conclusion of which bucket to choose essentially was which one had the most impact. So postpartum hemorrhaging that I mentioned is 35% of maternal deaths. So that makes it the leading cause of maternal mortality, which is hence why we picked this as our problem. So we thought that this was the solution. We just had to solve postpartum hemorrhaging. But that wasn't the root cause. Solving postpartum hemorrhaging was not only medically advanced, but also it was too general. It wouldn't solve the actual issue. It was frustrating because every time we thought we found the actual issue, when we looked at the solutions, it was barely scratching the surface. From this, we asked ourselves why every time we came to a cause or an issue. This was our train of thought. Women bleed to death. Why? Because they don't reach primary or secondary care in time. Why? Because TBAs don't monitor afterbirth properly. Why? Because you're not formally trained to do so. Why? And we just continued from there until we reached a spot where we couldn't ask why anymore. So at the end, for us, we had two root causes. One, TBAs were not formally trained to manage complications for childbirth or monitor afterbirth. And two, there was a large accessibility problem in Nigeria as well. After figuring out the root cause, we went through current solutions for the issue. What is currently being done and why isn't enough? We looked at hospitals in developed countries to look at what they've been doing so far. I was excited after learning that they just use medication like oxytocin, which is like misoprostol, the drug I mentioned before. I thought we could replicate oxytocin and everything that they were doing in these developed countries in Nigeria. But I soon realized that that wasn't possible. It was a naive mistake because of a barrier I spoke about before, cultural implications. We tried looking at solutions related to medical devices, but we realized that this wasn't accessible and it wasn't a low resource solution. So we started to look at low resource solutions, something that doesn't need hospitals or a lot of tools and can be replicated very easily in developing countries. That's the solution I mentioned previously, a drug that has recently actually been recommended by the World Health Organization, misoprostol, for the management and prevention of postpartum hemorrhaging. After we settled on current solutions, we brainstormed ways to make them better. After speaking to a few experts in a few meetings, we realized that the use of traditional birth attendants, TBAs, to administer the drug, misoprostol, would be a game changer. Now we had to use this information to design our solution, which is the final step. With this new knowledge, we came up with a curriculum to train TBAs on misoprostol and maternal care. The goal would be to ensure that TBAs are properly trained on how to administer misoprostol, as well as general maternal care and afterbirth and delivery procedures as well. We also designed pictorials as a way of education since most TBAs are illiterate. The third part of our plan was a better distribution system for misoprostol. The system includes all the key stakeholders like community leaders, the government, and the community. In the future, we want to hopefully use a technology aspect to track the drug. So where has this journey taken me? What started 2 years ago as a side project to learn more about the issues in healthcare has now transformed into an organization called mHealth. I work with an amazing group of students who are working to distribute a drug to tackle the leading cause of maternal mortality, postpartum hemorrhaging. Working with the help of over 50 medical and industry expert advisors, we have developed a multi-pronged framework, and in terms of projected impact, we estimate that we could save around 22,700 mothers with the use of misoprostol in our intervention. We also have interest from various areas in Nigeria to implement our intervention there as well. In the future, we hope to have an impact in box model that will be like a starter kit for anybody who wants to create sustainable change locally. It will include our training curriculum, our distribution framework, and the pictorials. We are currently in the process of implementing our solution with the help of our on-ground partners in Nigeria. Journey building mHealth has taught me the importance of a strong team, mentors, and a passion for the issue. Reposting an infographic isn't enough. Mindlessly attending a march or a protest isn't enough. Occasionally donating $5 to a random organization isn't enough. I urge you to research the issue, think about a solution, or work with a team to figure it out. If you're someone who has experience in a specific industry or field, please mentor someone or help someone who is interested in making a change in the field. If we even have one more person actively making a change, it can exponentially change our world.